severe pain in my right wrist. I came to see Dr. Patel after I was informed that I would need wrist fusion from my orthopedic surgeon. He did one ligament repair surgery because I have a torn ligament and a detached muscle in my right wrist. I wasn't able to hold an empty coffee cup.
Wow.
That's how the pain was. It was so severe that I couldn't even move, I couldn't even function. When I came to see Dr. Patel, she highly advised and encouraged to get the PRP injection along with other treatments that we may or may not need in the future. Long story short, I went from having single percent mobility and strength in my right wrist to being able to play now 6 months later, approximately 6 months later, I am doing 36 holes of golf.
Wow.
So I went from having 2% mobility, about 4% strength, to nearly having a normal life function. Even though the wrist right now is still not at 100% healed, the quality of life is astronomical.
Was it just one treatment you had?
Pause for one moment.
Yeah.
I'm sorry. Her mic is not on. And
How many treatments did you have?
We had 2 treatments,
Yeah.
two injections of the PRP injection. The first one did very well, but Dr. Patel wanted to do a second injection because of the great percentage of relief and healing that I was getting. The injection wasn't covering up any of the pain or any of my symptoms. It was actually healing. With the MRI results, the imaging, when I have complete 100% torn ligament and the fibers were not even connecting to, now they were slowly starting connecting, the ligaments were attaching themselves back together due to my own white blood cells or the magic that Dr. Patel performs.
Wow.
The guardian angel that she is upon my life, that she brought me nearly to a status where I can function and be happy with the condition that I'm in currently, and I'm not even at 100% healed.
So show us your wrist.
My wrist, but when I first came in, this was my mobility.
Otherwise, extreme pain.
Extreme pain, nearly, I would be teary-eyed from the pain. After 2 injections of PRP, no pain.
And again, you're golfing?
And I'm golfing. I was a very avid golfer. It's one of my passions, along with being a chef, creating foods, and in my profession, I need my wrists. I need them to work. And being a golfer, a very avid golfer, I haven't been able to play for 2 years. I would go try to, but it was actually an embarrassment because you can't hold a club because the pain is just unbearable. After 2 injections, this past weekend, I'm very happy to say I played a consistent 36 holes back to back 2 days in a row.
Wow. So your life has changed.
My life has changed drastically for the better.
Now, Mom, what was happening with you?
Pretty much just like he said, I had so many surgeries. I had carpal tunnels, I have surgery, I had also rotated cuff surgeries, and my knees were killing me to the point that I was not able really to walk stairs, carrying stuff, not even drinking a coffee. For me to have a cup of coffee, I would basically hold the cup with one hand and kind of secure with the other hand, Then it got to the point that I would start drinking a coffee to the straw, and at that point, the pain is really huge. It's awful, and Peter has been talking about it for longest time, and so you gotta go see Dr. Patel. You gotta go see Dr. Patel, and that's what I've done, and that's probably was the best day in my life that I walk into this door. And on top of everything, that she is the most wonderful doctor you ever meet in your life. She is a person that I, in my profession, I work with a lot of people, hundreds a week, okay? And to have a person like that is not just she's not just a doctor, okay? She talks to you, she's assure you, she is explain anything and everything the way you can, and you almost like walking out the door, and you know it's like sky is the limit, you know, we're gonna find something that's gonna work for you, okay? And so with me, it was like with this, I've been here for probably, I don't know how many other patients, how long they've been here, but I've been here since March, okay? And my right wrist, I already had carpal tunnel surgery on it, and so the mobility itself was already limited right after it. Even if I had the surgery, I went to a physical therapy, and the mobility in my right hand was very limited. And on the top of it, there was a huge pain, you know. So right now, I did had 2 injections, and right now, okay, I don't want to jinx it. God, I don't want to jinx it. I'm like 100% on my right hand, okay? Honestly, I don't want to jinx it, okay? The left hand is a little different. It was like, I think, more damage to it even from MRI. So, you know, I'm not anywhere near with the right hand is. But honestly, even if it doesn't really happen, nothing bad happens, and you know, I'm perfectly happy. I'm like, I would say like 75-80% to it, okay? So if I would really stop right there, and let's say the PRPs are not gonna help me anymore, I'm so happy, because it's not, this is a completely a different life, and you basically are pain-free.
So you had it in both of your wrists?
Yes, I had both wrists, both knees, and rotated cuff.
And everything
bionic process.
Everything feels better.
I'm telling you, everything. I could give you different percentage of it, okay? Like my right knee, 100%.
Yeah.
Right hand, pain, 100% free. Mobility, due to the carpal tunnel surgery, is limited. But pain-free on the right side, okay? The left side, we're working on it, we're getting there, but just like I said, even with my wrists, left, when I walked into this office, Dr. Patel had a hard time to examine my hands. I was like kind of robot. Okay, when she was like trying to push on it, I was already there. Yeah. But now it's a completely different story. My life changed. Oh my God, tremendously. You know, it's walking stairs, and you know, basically I do like to exercise a lot. I was not able to do it. I'm doing a treadmill now, elliptical, and biking. And doctor said not biking too much, but I did it. I'm sorry, I did it a little bit. You know, so I'm kind of watching that. But so I'm easy on the biking due to the left knee, not even the right knee. Right knee is great. You know,
Now,
so I'm.
but you talk about you have a family business and you're always on.
Yes, always 24/7. Sometimes when the weekends come, we working. We don't have 5 to 7 or whatever
Right.
jobs. Okay, sometimes we are on our feet at 20 hours a day.
Catering business.
Catering
Yes.
business, family-owned catering business for 20 years, and in our profession, it's very physical, it's very demanding. We don't have a stationary job. We're not fortunate enough or privileged to sit behind a desk or sit in a lovely chair. We're always on the go, and it's 20 hours, sometimes 20 plus hours on our feet.
Yeah.
A lot of lifting, a lot of carrying, and we have to be mobile. Every single part of our body has to be working in order for our line of work to provide a 100% success rate to our clients.
All right. Okay. Awesome. That was great.